In today's video, we'll be talking about how to deal with heavy bleeding during perimenopause. If you're new to this channel, I'm Dr. Shadi Tabai. I'm a naturopathic doctor and a women's health and hormones expert. And Lord willing, every week I'll be making videos on this channel about women's health and hormones. So if you're interested, consider subscribing and liking this video. Today I want to talk to you about heavy bleeding during perimenopause because it's a very common concern that I see in my clinical practice. And it's a common reason why perimenopausal women do visit the doctor's office. Now, I want to talk to you about why it happens, and I want to talk to you about potential treatment strategies, both conventional as well as natural treatments. So why does heavy bleeding happen during menopause in the first place? Well, there's a number of reasons, number one being hormonal. Perimenopause is a very chaotic time for the body. As the body transitions from a reproductive state to a non-reproductive state, ovulation becomes quite erratic. 1 month you may ovulate twice, 1 month you may not ovulate at all. And in both cases, you can see heavy and irregular bleeding. If you ovulate twice in a month, you might notice that you bleed twice in that month. And if you don't ovulate that month, you may notice non-ovulatory bleeding, where you bleed just because your uterine lining sheds and not because you ovulate. And then if there's been quite a couple months where you haven't bled, then you may have an extensive bleed because the uterine lining has grown so much and it hasn't shed. And so once it does shed, there's just a lot to shed. So hormonal reasons are one reason why heavy bleeding can occur, but not the only one. The second reason why heavy bleeding can occur during perimenopause is due to structural issues. So fibroids and polyps do become quite common in women's 40 and up. And so this is where it begins to grow and it can cause issues, primarily causing heavy bleeding. This is why I always recommend that my patients with heavy bleeding go and get a vaginal ultrasound done just to rule out any potential fibroids or polyps. The third reason why heavy bleeding may occur is due to a sluggish thyroid. As women age, their thyroid tends to slow down. And the slower your thyroid works, the more likely it is that you'll have heavy bleeding. So getting your thyroid tested is important in determining if that's the reason why you are bleeding. And then the fourth reason why you may be bleeding heavily during perimenopause is due to low iron. When your iron is low, you will bleed more. And when you bleed more, you lose more iron. So it's this vicious cycle that happens as a result of low iron. So it's important to test your iron and treat it if necessary. Okay, now that we've talked about why heavy bleeding occurs, I want to talk to you about now how to treat it. I'll first talk about some conventional approaches that the medical doctor may offer you, and then some natural approaches that are available as well. So when you go to see your medical doctor, there's a number of things that they may offer you. Number one, you may be offered a medication called tranexamic acid. What this medication does is that it reduces the heavy bleeding by slowing down your bleeding. And so it can be a valuable way once you are bleeding to slow down the bleeding. However, it is hard on the liver, and so you don't want to primarily rely on it. The second thing that you may be offered is birth control. What birth control does is that it shuts down your own ovulatory pathways. And so the erratic ovulation will no longer cause irregular bleeding, which can be helpful to regulate things for you long term. However, the risks with birth control do go up as women age. So 40 and plus, we can see an increase in cardiovascular disease risk when using birth control. And the third thing that your medical doctor may offer you is a hormonal IUD. Now this is actually not a bad idea. A hormonal IUD releases progesterone locally at the side of the uterus and can reduce heavy bleeding without having the systemic effects of birth control and hormones. So it is a viable option as well. Your doctor also may recommend an ablation. This is where they basically cut off the blood supply to the uterine lining so that it does not grow as much. And so this can often cause bleeding to just cease for many years, and it can be an effective way to stop bleeding or at least reduce the amount that you bleed. the last option that you may be offered is a hysterectomy, where you remove your uterus. And this is the most invasive option, so it's not to be taken lightly, and you want to exhaust other sources before you go down that route. So those were some of the conventional options. Now, I'm a naturopathic doctor, so I do want to talk about the natural options, and the patients that do come to see me, they also want to see what are some natural alternatives before they try some of those conventional options. So let's talk about a few. Number one, I always recommend seed cycling. Now, seed cycling is basically using seeds to support the different parts of your cycle. So we have two parts in our cycle. We have the follicular phase, which is the first half of the cycle, which is predominantly an estrogen dominant part of the cycle. And then the luteal phase, which is the second half of the cycle, which is predominantly progesterone based. And so we can use seeds to support the different parts of our cycle and balance those parts. So in the first stage, I usually recommend having a tablespoon of ground flax seeds and a tablespoon of pumpkin seeds on a daily basis. And then in the second stage, I recommend having a tablespoon of sesame seeds and a tablespoon of sunflower seeds to help balance the progesterone. Now, if your cycles are not regular and you don't have like a monthly cycle, what I usually recommend is just start on the first day of the month, and then break the month in half and just pretend that you have normal cycles. And the first half of the month do the pumpkin seeds and the flax seeds, and then in the second half of the month do the sesame seeds and the sunflower seeds. Now, this isn't the most scientifically based method, but in my practice, I have used it with many women, and it has seemed to benefit the perimenopausal women in terms of the regularity of their periods. The second thing that I usually recommend is ginger. Ginger is an extremely powerful anti-inflammatory root that helps reduce heavy bleeding as well as menstrual cramps. Usually I recommend it in a supplement form, so you're getting a higher dosage, although feel free to liberally have it in your diet as well. But I do recommend a dosing of around 250 milligrams per day of the ginger to help reduce heavy bleeding during menses. The third herb that I sometimes recommend is chaste tree. Chaste tree is a herb that helps to regulate our sex hormones, primarily FSH and LH and prolactin. And in some women, it can help to regulate cycles where they're not so erratic. It also comes in a capsule form, and I usually recommend having 2 capsules per day at around 80 milligrams each. Now, some women will ask me about bioidentical hormones. Will that help when I have heavy bleeding? And my answer is maybe. For some women that are on the bioidentical hormones, they may notice that their period stops, and that's really nice if you're having heavy periods. But irregular periods are also one of the side effects of bioidentical hormones, and so there is a potential that there may be some more irregular bleeding. So you really don't know until you try it. So if you have other symptoms that may be beneficial to treat with bioidentical hormones, like hot flashes or vaginal dryness or disturbed sleep, then that might be a scenario where you would use the bioidentical hormones. If you have more questions regarding bioidentical hormones, I do have videos about them, so feel free to check them out on my channel. But otherwise, those are some of the natural treatments that I usually start with. And if you get enough relief from the natural treatments, great. Then stay with the natural treatments, but there's always those conventional options as well if the natural treatments don't work for you. All right, well, let me know what you thought in the comments below. If you've used any of those treatments or if you have any questions, let me know below.